is Los Angeles Skid Row HIV specialist and family nurse practitioner, Pattye Anderson, or Nurse Pattye. Before I read her short biography, Nurse Pattye came here. She had to work, came to be here from Los Angeles, and so we are very grateful for her to be here with us tonight. So Nurse Practitioner Pattye Anderson is licensed in California and Arizona and completed her bachelor's education at USC in Southern California in 1994 and her master's degree at UCLA in 2004. Pattye Anderson has been a nurse practitioner for over 20 years and is board certified by the American Nurse Credentialing Center in Family Primary Care and by the American Academy of HIV Medicine as an HIV specialist. Pattye is also seasoned mental health and weight loss practitioner. As a doctoral scholar at Capella University, retention in HIV care is her research focus. She is currently completing a capstone intervention project addressing the utility of scheduled electronic reminders to promote retention and HIV care. Nurse Pattye has a flexible schedule to help meet patients' needs. Pattye's work experience includes work among the unhousing population in Skid Row, where undocumented individuals often seek help in shelters and missions. Assistance is needed by groups who have other concerns, such as chronic mental illness, substance abuse disorders, and sex trafficking. Regarding Ms. Pattye's advocacy background, she focuses on being a clinician who is known for listening to patients' needs and making sure that physical, mental, and other attributes of their healthcare are being addressed. Pattye has a black belt in Taekwondo and participates in several endurance events, plus full and half marathons annually to raise awareness for teens and young adults with cancer. If that was me, I would not want to mess with her Taekwondo. Without further ado, our next speaker, nurse practitioner Pattye Anderson.
Wow, so I'm very, very glad to be here. I'm going to put my back down. Give me a second to just get set up.
I think you can hold the mic so
Get myself all set up. If you don't mind. Alrighty. Well. Thank you very, very much for having me. I do have a black belt, so if anyone needs some protection, I got you. I did come from Los Angeles County, and it was my honor and is my honor to be here and to speak to you all. That being said, I just want to say thank you so much for allowing me to speak today. And I am truly grateful for doing what I get to do. I work on a mobile unit in Skid Row, Los Angeles. And there was a profound quote by a man named James Baldwin who said, not everything that is faced can be changed, but nothing can be changed until it is faced. And that quote by James Baldwin speaks to the importance of confronting difficult times and difficult truths. And it is a necessary step in addressing the physical, mental, and emotional health of our population. This quote resonates with me and in the context of health, and it does emphasize the healthcare crisis that we are all experiencing and that we need to meet it head on as a means to make progress in the global society. For those of you who are unfamiliar with Skid Row, it is home to thousands of people that live on the streets of Los Angeles County. It is a 52 square block region known as a place where poverty, mental illness, addiction, and trauma intersect, and it becomes highly visible on every block. This area was glamorized by a recent documentary about a safe landing site where people can stay for 1 to 2 weeks while care and case management services are performed. Has anyone heard of the Cecil Hotel or seen the documentary? No. Some have. The Cecil Hotel is the location that turns Skid Row into a sort of amusement park for visitors to show up, leaning outside their car windows with their cameras to catch a glimpse of where tragedies have occurred for decades. Skid Row isn't a glamorous place to work. It's messy, it's challenging, and at times it can be very heartbreaking. Patients arrive without shoes, acrid, disheveled, often intoxicated, sometimes combative, and sometimes even entitled. Others arrive humble, tearful, or muted. Still, it is also some of the most meaningful work I could ever imagine doing. The community is one of the most vulnerable in Los Angeles, and often the people there feel invisible. They feel left behind by society. Many are struggling with substance abuse, mental illness, and other chronic diseases. Often when patients arrive without shoes, they come with swollen feet or festering wounds from standing and walking on concrete and hot pavement. Those who arrive intoxicated, sometimes known as tweaking from crystal meth, or some are very somnolent and drowsy from alcohol or fentanyl. They fall asleep during their exams. Some are aggressive or contentious and can be difficult, yet there are those who arrive very respectful, and they're very happy to find us there and receive care. Increasingly, we see more and more individuals who arrive with HIV, and they do not have proper access to care. So working as a healthcare provider in this space isn't your typical 9-to-5 job. It requires a deep understanding of humanity, resilience, and the flexibility to meet people exactly where they are, in the literal and figurative sense. Our mobile clinic, which functions as a small but vital resource, operates out of a trailer home that's been outfitted with basic medical supplies and equipment. We drive through Skid Row every day, providing critical services to those who have nowhere else to turn. And as a nurse practitioner, I see patients facing complex health challenges. Many of them have untreated chronic illnesses like diabetes, depression, amputations, and hypertension, complicated by homelessness and substance abuse. Many lack insurance or identification. Some don't have a phone to make an appointment or to schedule a follow-up or a telemedicine visit. Imagine that. But one of the most significant health issues we still face is HIV and other infectious diseases. HIV disproportionately affects this community, but it is not just the virus we're fighting. We're still fighting against the stigma, lack of resources, and often a deep mistrust of the healthcare system. For many, the diagnosis carries a weight that extends far beyond the physical. It is a symbol of the barriers they face, the isolation they feel, and the challenges they endure. But despite all of this, I believe in the resilience and strength of my patients, and I'm constantly amazed by their willingness to trust us, even if only for a moment. One of the most important things we do on the mobile unit is create a safe space, a place where people feel seen and heard. For many of my patients, our mobile unit may be the only place they encounter kindness, respect, and a non-judgmental clinician. We aren't just handing out medicines or sandwiches or hygiene kits. We're not just offering a quick checkup. We're building relationships. Our patients know that we're coming back. We're not just a faceless institution. We are a part of their community, and that trust can be life-saving. Our interventions extend beyond traditional healthcare. We offer harm reduction services like Narcan, condoms, and some institutions offer clean needles. We counsel patients on safer practices, and we help them to navigate the complex system to get their identification, apply for insurance, SSI, access their mental health services. It is about looking at healthcare in a way that doesn't just treat the immediate problem, but addresses the whole person. When we take the time to understand their lives, their struggles, and their stories, we can tailor our approach to fit their unique needs. Now, of course, our mobile unit has its limitations. We don't have fancy equipment. We have an exam table, but we don't offer specialized testing. We can do a pregnancy test, a rapid HIV test. We can do a rapid A1C, and some locations can provide a rapid Hep C screening. But sometimes the resources we don't have, that we have, cannot match the severity of the needs of our patients. But we work within these constraints because the alternative is doing nothing, and that isn't an option. When we meet the patients who are HIV positive, we focus on getting them connected to care, providing information, and helping them understand their diagnosis. For some, it is the first time that they've spoken to anyone about their health status in years. Now, this isn't easy work, as I've said. There are days when it feels like we're up against Goliath. We're up against a tidal wave of challenges. I've seen patients relapse after months of progress. I've seen people who were on the cusp of turning things around slip through the cracks. But there are also moments of profound hope and moments that remind me of why this work matters. I think about one patient who I'll call Chris. Chris had been living on the streets for over a decade and struggled with addiction for many years of his life, even though he had a family. He was recently diagnosed with HIV and had never been able to access consistent health care. When I first met him, he didn't want to look me in the eyes. He was skeptical, wary, and had every reason not to trust me. But little by little, visit by visit, he opened up to me. And today he is on an antiretroviral therapy, and his viral load is undetectable. He's in transitional housing and working towards stability. And while his journey isn't over, he knows that he has someone in his corner. And that's the power of what we do. I stand here today not just as a nurse practitioner, but as someone who believes deeply in the humanity of every person I meet on the streets. The people of Skid Row deserve dignity, respect, and a chance to live healthier, safer lives. They are not just statistics or problems to be solved. They are our neighbors, and they deserve our compassion. There's a saying that says, the greatest wealth is health. In practice, it's far more complex than just a phrase. Health isn't just a prescription or a doctor's visit, and it certainly isn't free. It is, however, more valuable than material riches and forms the foundation for a fulfilling life. It is safety, stability, and community. It's having a place to sleep, food to eat, and people who care. And as long as these fundamental rights are out of reach for the people of Skid Row, I will keep showing up with a mobile unit day after day, meeting them where they are. Thank you for listening and caring. And I hope that you leave here today, as you remember, every single person has a life that matters. Supervisor Williams spoke about the modular homes, very familiar to us. We also go to, we call them tiny homes. And I'm just glad to be a part of this movement where now we are caring for unhoused people. So if anyone has any questions. No?
What?
Yes.
Can I have your autograph?
Sure.
Thank you.
Yes.
How do you get your funding?
Ooh, well, so the place where I've worked, they are really good at acquiring grants, public grants, the waivers. There's one grant called a Haluna grant. I don't know if anyone's familiar with that grant, but that grant specifically works to provide incentives and services for patients that have HIV and for HIV prevention. But there's several grants that are available and other partners that are invested. Yes.
When you were at UCLA, was part of your clinical working down there?
Actually, no. At that time, I was honestly more focused on not street medicine. I was more focused on the Crown Act, which is a completely different lifetime. So the Crown Act is about natural hair and oh boy, and it's about natural hair and the acceptance of that within the workplace. And so that was mostly my focus, and also public health. So I've always been very invested since my USC days in the HIV epidemic and dilemma. Yes.
How do you, with like addiction going into play and mental health, HIV is very complex with like, blood treatment. How do you like get people to stay compliant with dealing with all these factors? How is that?
So a great big part of getting compliance is the incentives and getting patients to trust. And so if you can provide them with programs that are even going to offer them a weekly sandwich or a weekly gift card, that goes a long way. And sometimes, if there might be one company that is providing a gift card for $20, and then another outreach program is offering, a sandwich. Well, who are they really going to go to? They're going to go to the place that offers a gift card. And then another thing that I'm glad to see is there are many agencies that will provide a gift card just for HIV screening. So for a rapid HIV test, they'll get another gift card. And so you'll see several people getting their gift card just to check their status. The problem, however, with maintaining compliance with those patients that are already positive is that oftentimes their medications are stolen. So they might have, you know, a bottle of a medication that starts with a B, right? I won't call any names, but you know, they'll have that medication and that medication is stolen. And so they'll go maybe 3 months and, you know, they're viremic again, where they may have achieved undetectable status. So now we got to figure out how to get them back on meds and offer them solutions like a long-acting injection if it's appropriate. Yes.
Do you have any connection with or collaboration with the USC Street Medicine team?
Yes, yes, absolutely. I love my my alma mater. If it hadn't been for USC, I wouldn't be here today. And there is, for anyone that's interested, there is an upcoming conference. It's free. It's on December 3rd, 4th, and 5th. And it is at the Health Sciences campus. So it's a little drive, but I think it's worth it. You guys can carpool and I'll be there. So yeah, we hope to see
With
some
Brett
of you
and
there.
Corinne?
Huh?
Brett and Corinne Feldman?
Yes, yes. They're amazing. Yeah.
I guess maybe I just want to say something quickly, and I was going to talk with you specifically, but I'm Jory Nielsen, and I'm the family nurse practitioner and the medical director of the Women's Free Homeless Clinic, part of Doctors Without Walls, Santa Barbara Street Medicine. So we are doing what you're doing. It's all about building trust. It's about being in the same place week after week. Anyway, thank you for all that you do.
Absolutely.
And
Thank you for having me. Thank you. Thank you very much. Yes.
Oh, me? Oh, good. What do you do for security?
So a good thing we do is we have safe words. So we have codes, and we have kind of our head on a swivel. You kind of have to know the community. It is not just a place that you just show up and, you know, you wear your stilettos and you just show up and, you know, you don't just do that. You show up and you recognize that there might have been a shooting an hour earlier. So we also keep walkie-talkies, and we also try to keep a presence of people that are protective. So, but not just that, we have a presence of people that really are in touch with the community. So, for example, we have someone, I'll call him John. He's been in the community for over 25 years. Everyone knows him. They see him and they're like, Brother John, Brother John. You can't walk a block without someone calling him. So, you know, we have some protection built in. And then there's training.
And USC and UCLA, I know, send people down there in their nurse practitioner programs to work. And do you have one or two, or?
So sometimes there's groups that go out together that are it's called backpacking. So there's either the unit that drives and parks somewhere on a regular basis, and the community becomes very familiar with seeing this unit show up every week at the same location. Or we also have days when we do a half day of backpacking in groups. Mm-hmm. Yes. Well, thank you again so much for having me.
There's something going on called code gray, which means you just you pick up incredibly just quietly leave.
Thank you.
And call 911.
Thank you for coming. Thank you so much.
It's amazing.
Thank you. I appreciate it.
Thank you.
I'm going back.
You're a great woman, we know that. Yeah.
I have 2 chow chows at home, and they would be really angry if I didn't come home. Thank you.
Once again, our dear friend Bernice Garrett.